Hello and welcome to another awesome Archie non-profit send support video. As always, this video is for you to share within your schools, within your organisations and within your home if you feel that it's going to be useful to you. This comes at no cost, obviously, that's why we do what we do. But if you have found this useful, if you could give us a little shout out online, that would be really appreciated. It means that our message can continue to be spread in the way that we need it to, and our neuroaffirming advocacy task will be well underway. So today we're going to be talking about Tourette's, and it's Awesome Archie's Back to Basics guide. And it's important that I share with you that this is our lived experience. It's being recorded live. Don't worry, for those of you who are joining us live, your voices, your faces, your questions will not be recorded or shown on this video. They're for me only, so don't panic. And do feel free, like I say, to download this video or share it for you to use as you wish. So let's get into it. Let's talk about Tourette's and Awesome Archie's Back to Basics guide. This is our lived experience to Tourette syndrome, and specifically how we were wrong about so many things. We're going to try and myth bust for you, and we're going to share what Tourette's means for us and for Archie. As a team, we've always been very open and honest about the highs and lows of supporting a family member that has complex neurological differences. Awesome Archie is autistic, he has ADHD, a bowel condition, sensory sensitivities, and has Tourette's. If you can hear jingling, it's just my beautiful elderly cat joining in. We would encourage you, please, to check out our website at www.awesomearchie.co.uk and to visit us on all of our socials and our YouTube channels. We have many additional presentations. Some of them are for educational purposes. Some of them are for parent-carer purposes, most of which can switch over to and fro. We want to support both mainstream schools and families, but this time we're just going to focus on Tourette's. So what is Tourette syndrome? Well, the NHS website states, Tourette syndrome is a condition that causes a person to make involuntary sounds and movements called tics. It usually starts during childhood, but the tics and other symptoms usually improve after several years and sometimes go away completely. There's no cure for Tourette syndrome, but there are treatments that can help to manage the symptoms. See, for this, when we had the diagnosis is not overly helpful. What did it mean actually for us as a family? What did it mean for Archie? Well, we know that every autistic individual is completely unique, so it should come as no surprise that Archie's Tourette's affects him far differently to what we had expected. And I don't mind admitting it's because we hadn't looked into it. We hadn't done our research. We assumed that Tourette's was one thing. Well, actually, it really isn't. It's way more complex than that. For example, this is our first bit of myth busting. Archie does not swear, and apparently this is so common. Many people with Tourette's don't swear, so this is something that we learnt about. In fact, did you know that swearing is really rare and only affects about 1 in 10 people with Tourette's syndrome? And the medical term for this is coprolalia. So how else can Tourette's present itself? Tics are the main symptom of Tourette's, and they usually appear in childhood between the ages of 2 and 15. And this is right for Archie. I think he was about 13 when we started to notice, and he's now 16. People with Tourette's syndrome have a mix of physical and vocal tics. So that's how you get a Tourette's diagnosis and not a motor tic diagnosis, when you have those vocalizations as well as the physical tics. And examples of physical tics can be blinking, eye rolling, grimacing, shoulder shrugging, jerking of the head or limbs, jumping, twirling, touching objects, or touching other people. And vocal tics can include a grunting, a throat clearing. This is what Archie has. We lovingly refer to it as the backwards cough. I can't do it, but it's quite amazing. Whistling, tongue clicking, animal sounds, or saying random words and phrases, or repeating sounds, words, or phrases. Now, it's important that I say to you that we have got this information from the National Institute of Neurological Disorder and Strokes. But as a team, as neuroadvocates, we prefer to use the term difference, not disorder. But it's only right that I share their correct title. And they state, although the exact cause of Tourette syndrome is still unknown, current research points to differences in certain brain regions, including the basal ganglia, frontal lobes, and cortex circuits that connect these regions. They're the neurotransmitters responsible for communication between nerve cells, or if you're in the profession, neurons. So now we know a little bit more about Tourette's. Actually, what does that mean for us? How can we practically put in a measure of support? Well, there are lots of things that we can do. We must be patient and calm. Tics are uncontrollable, and so people with Tourette syndrome will probably feel quite embarrassed or frustrated by them already. So we need to just remain patient and calm to be that support for them. We can encourage physical activity. So when Archie is really, really going, and I can see that he's really going to start causing himself soreness and perhaps muscle injury, we actually get him to move. So if we take him out on his little scooter or send him out on the trampoline, that can actually channel that pent up need for movement into a less damaging tick for him. It sometimes works, it sometimes doesn't, but we never, never, ever try to stop the movement. That's just not doable. A tick is there, it needs to come out, and you can tick while doing other things, but you must never try to stop it. Also, we have found, and it states here, that it does enable them sometimes to focus. So actually, if Archie needs to do a task in which he needs real focus, movement will help him to do that. We as a family ignore unharmful ticks. I mean, if they're not going to be hurting himself or others, there's no need really to bring attention to them. I will say, and I have stated here, that you are going to get people that stare at you. You are going to get people that make horrendous comments. And I'm still learning to bite my tongue. I'm still learning to look at those people as probably ignorant and not very kind. And I turn that anger and my desperation to say something rude into support. And I put all this solely into Archie. And many, many times I will remind Archie, don't worry, they just don't understand about Tourette's, to a point now where he is starting to pick up people's negativity and say to me, don't worry about it, Mum, they just don't understand Tourette's. It's very difficult to do. And I'm not a saint. There are days when I can't do that and I snap back. But I don't encourage you to do that. It doesn't help your child in the end. If you are in a headspace to confront someone gently about it, then explain what Tourette's is. So many people will look at someone with Tourette's. Now, we can't get angry with them for that because it is unusual to see somebody walking around a supermarket ticking or particularly vocalizing. Actually, we mustn't worry about people looking. That's everyone has a right to look where they want to. But if people are looking in depth and to a point staring, you could always actually, if you're feeling brave enough, just say, Archie's got Tourette's. Would you like to know a little bit more about it? Often people do want to be understanding and they're trying to be respectful, but they just come from a place of a lack of knowledge. Hence why we do what we do here and why we're giving you this presentation. You can also find so many support groups. The Tourette Syndrome Association sponsors support groups for people with Tourette's and their loved ones. There's a plethora of groups online. Some of them I have found if you join them, you only get the negative side. For me, that isn't helpful. As a neuroaffirming carer, I want to try and look at the situation we're in. I'm not about toxic positivity. It is tough at times, but I don't feel wallowing in self-pity helps me. I feel that trying to get advice from a practical standpoint and sharing that love is what's helpful to us as a family. So do be careful if you're going to join any groups online. Don't try to fix them. They're not broken at all. And this is something that so many people struggle with. We have a family member who has had a stroke, and that stroke has left him with involuntary movements. And it is something that I've had to explain to my children. He didn't have these movements before. His stroke has actually meant that his brain is different. He may have lesions within his brain that are affecting him to now essentially have motor tics or Tourette's. And that's an adjustment that we have to make. It's not an adjustment that he should make. He doesn't need to be fixed. We need to alter our behavior around him. And that's actually what we need to do with our children. It's not our duty to try and fix something that's not broken. It's up to us to adapt to their needs and to support them where they are. Help them to research their own condition if they're old enough, of course. I know some of you watching this are going to have younger pupils or younger children. If you're in a school staff situation, obviously don't step into the research situation without prior conversation with parent carers. I'm sure I don't need to say it, but obviously it's not our decision to diagnose your pupils. It's up to the parents. But if they are happy to talk about it, go for it, jump in. It's a great thing. And it will encourage your pupil to know that you are on the same page and that you're learning together. It's also really important, and we've done this with Archie, that his consultant has actually talked to him specifically because he is of an adult age now where he can make his own decisions with support from us. He's not completely able to make independent decisions of such magnitude, but he was asked directly, are your tics, is your Tourette's upsetting you? If it is, you're welcome to try medication. And he politely said, no, thank you. I'm okay for now. So it's important to let your loved one or your pupil to have decisions in the way that they are treating, or, perhaps they may want behavioural therapies, etc. And if you're a parent or if you are a SENCO, talk to their teacher. Make sure you're both on the same page. If tics are making things difficult at school, then they can talk to their teacher. And likewise, if you're an adult worker employer, to find out if there's any additional help or support available. As a family, we're still learning about Archie's Tourette's and Tourette's in general, and we're really trying to focus on how best to support him. It's a journey. He's been offered medication, we've discussed this, that can ease his symptoms, and he has decided at the moment to stay as he is. He knows that that is open for discussion at any time. Also, behavioural therapy, and this is something we're going to be heading into, has been offered by the NHS. So if you are interested in that, just please contact your doctor and you can be referred to a psychologist or a specially trained therapist. So what have we learned on our journey so far? And it's important to say that the information I've given you here is present as of today. As of today, we feel like we're up to date with where Archie is. But as we know, with any neurological difference, there are going to be changes. Situation, environmental, everything can have an impact on both from a positive perspective and a negative perspective. But we have learned as a family that the thing that has helped us the most within our learning is supporting others on our journey. I don't know whether that's because I'm a neurodivergent person too, and actually putting things down in a visual presentation helps me absorb information. It's how I learn best. But it also makes me feel a little bit more in control of a situation that I would otherwise not be in control of. I am able to share Archie's differences with his permission, and we are then able to hopefully spread awareness and understanding and acceptance, and if nothing else, just a bit of empathy and a bit of kindness to the wider society. And it's also important for us to finish with the fact that we know that Tourette's is a massive part of Archie. It is a huge part of his life, but it doesn't define him. Archie is an incredible young man who has many, many, many challenges, but he's remarkable. And we're so incredibly proud of him. Hence the title, Awesome Archie, because he truly is awesome. We must say thank you for your time. If you would love to share this presentation, please do. If you'd like to like and subscribe to our channel for more content like this, then we would love you and encourage you to do that, please, because it helps us get our message across. And as always, please do follow us on all of our socials and check out our website, www.awesomearchie.co.uk. Thanks for your time.